Hello, and welcome to our El Camino College Student Health Services Vaccine Q&A. I want to tell you a little bit about the vaccine and share with you what we know, what we don't know, hopefully dispel a few myths and answer your questions. My name is Deborah Herzik, and I am one of the nurse practitioners at the El Camino College Student Health Services. This was a team effort with all of our nurses and office staff, and I hope that you find this helpful. And since this is not a live interactive platform, I'm going to give you some information at the end about how you can get all of your questions answered. Okay, so thank you for tuning in, and we'll go ahead and get started if I can figure out how to share my screen. There we go. So just a heads up, some of this is pretty dry, okay? So it's some vaccine basics. It may be very redundant for many of you, but we want to make sure and cover all of our bases. So let's get started. So I wanted to, I'm going to read this part. This is acknowledging structural racism and ableism and other forms of oppression. And El Camino College recognizes that historical and current structural racism, ableism, and other forms of oppression have made it difficult for some communities, such as Black people and people with disabilities, to fully trust the public health, medical, and scientific community. We want to be open and honest about the safety and development of the COVID-19 vaccine. And like I said, share with what we know and what we don't know. So I'm going to tell a story because that's what I do. A friend of mine who is an older Black woman, she is a grandma and she is really afraid of needles. And she's afraid that there is aluminum in the vaccine. It's going to add to dementia. She's heard a lot of really scary stuff. And I think what I was able to do, and I hope that we can accomplish some of that here, is give her information and help her make an informed decision. First of all, there's no aluminum. You're not being injected with metals. I'm going to go through what's in it and also the development of it so that you'll know that it was safely, it was really developed with safety in mind. And but most importantly, I think is, in her case, she is, like I said, a grandma, and she has 3 grown children, and she's got a bunch of grown grandchildren, and they're all looking to her. They're waiting to see if she is willing to get her vaccine. And so for her community, her family, her friends, the friends of her children, the friends of her grandchildren, they're going to all be looking at each other. And so it's really important. She's coming in to get a vaccine, by the way. So she's going to save lives. She's going to save possibly the lives of her family. And it keeps going on and on. So out in the community, there's a lot of reach. So I want you to, think about this. I get it. I understand the fears are legitimate. Historically, there's been some horrible, horrible things that have happened in the past. And there's a lack of trust, and I get it. But that's why I'm going to give you information today. So we'll go from there. So what is a vaccine and how does it work? And I warned you this was going to be dry. Vaccines prevent diseases that can be dangerous or even deadly. They work with your body's natural defenses to safely develop protection from a disease. A vaccine helps your immune system to produce antibodies. We're going to hear a lot about antibodies today. Just like it would if you were exposed to the disease. After getting vaccinated, you have protection from that disease without having to get the disease first. Okay, so this is really important. COVID is deadly. It has long-term effects. It causes whole body inflammation. It affects every organ. It can affect your whole life. You've heard about the loss of taste and smell. Well, that's neurological. It's in your brain. It's affecting your brain, your heart, your lungs. And the thing is, even if you are mildly symptomatic with it, which a lot of young people were even asymptomatic, but they develop symptoms along the way, they're called long haulers. And you might have heard about that term. But basically what that means is that you're going to have symptoms once you get over the acute illness. You don't have a fever or anything like that. You're not coughing. There might be some other symptoms that will affect you for months and months and months and even beyond. So even if you don't end up in the hospital, even if you don't end up on a ventilator or needing oxygen, even if you don't die, you can still have some really awful effects from this disease. So the vaccine will prevent the disease. It's not without side effects. We'll talk about that in detail, but it is so much safer than getting the disease. So keep that in mind. So this is what makes vaccines such powerful medicine. Unlike most medicines, which treat or cure diseases, vaccines prevent them. So there you go. What are the benefits of getting a COVID-19 vaccine? Well, COVID-19 vaccine will help keep you from getting sick from COVID-19. So we have seen breakthrough disease with people who are getting vaccinated, particularly here in Los Angeles County. We're seeing it. We're seeing people get it. But 97% of the people who are hospitalized, on ventilators, or are dying have not been vaccinated. So what this means is you may get a mild version of the COVID. You're not going to get those ugly, awful long-term symptoms. You're not going to end up in the hospital, and you're not going to die. And your friend isn't going to die, and your child isn't going to die, and your mom isn't going to die. Okay? So all COVID-19 vaccines available in the United States have been shown to be very effective. It's incredible. It's absolutely incredible how amazing these vaccines are. The combination of getting vaccinated and following CDC's recommendation to protect yourself and others will offer the best protection from COVID-19. So we've got a new mask mandate here in LA County. Darn it all. It's because there's so many people that are unvaccinated and it's been allowed to spread. And as long as it's allowed to spread, there could be variants that develop. And so we want to make sure and avoid allowing it a place to continue. We want to get people vaccinated ASAP. The more people get vaccinated, the faster we can get back to normal lives. Normal, whatever that is. Hopefully, we can hug our friends, have dinner, come back to school. We're coming back to school, right? That's you've all received the emails, and I hope, and it's coming. We're going to get back to work in school. 3 vaccines have received emergency use authorization from the Food and Drug Administration: Pfizer, Moderna, and Janssen. Here in the health center, we're offering the J&J. It's one and done. Now, that being said, I'll tell you, it's possible, maybe even likely, that at some point you're going to need a booster, just like you need an annual flu shot. I don't know, but for right now, it works really well, and it will keep you from ending up in the hospital. All 3 COVID-19 vaccines are safe and highly effective against serious illness, hospitalization, and death. The Pfizer and Moderna vaccines require 2 doses given at least 3 to 4 weeks apart. People should get both doses to be fully vaccinated in order to be effective. And that is really, really important. you've probably read, seen that there's a lot of people who get the first dose and don't go in for the second dose. And that is very problematic. Not only are you not protected, number one, number two, you're allowing the virus to spread. Okay, as long as it's out there, it can mutate, it can change, it can grow, it can accommodate. It's kind of a smarty. Anyway, we want to halt this. We want to stop this spread. So get both vaccines, okay? And the Johnson & Johnson, like I said, is only one dose. Again, the jury's out on whether we're going to need boosters. I suspect we probably will, but I don't know. Right now, we know it's really, really effective, so that's great. How do we know if the vaccine is safe? So vaccines in general go through more testing than any other pharmaceuticals. Small groups of people receive the trial vaccine. The vaccine is given to specific groups of people by age, race, physical health, and the vaccine is given to tens of thousands of people and tested for effectiveness and safety. Let's see here. I think there was something I wanted to. Okay, so safety is a top priority, and safety monitoring for the COVID-19 vaccines has been the most intense and comprehensive in history. The CDC's Advisory Committee on Immunization Practices looks at the data to see if the vaccine is safe and works. They give advice to the US Food and Drug Administration, the FDA. The FDA looks at the data and the advice from the Advisory Committee and decides whether to approve the vaccine. The vaccine is only approved after all these steps are done, and various teams of reviewers are sure that it works and that it's safe. So let's talk about J&J. This is an example of safety in action. On April 13th, the FDA and the CDC paused use of the J&J vaccine because 6 people developed a rare blood clot soon after getting the vaccine. Scientists studied the data about these blood clots, who was likely to get them and what might have caused them. And then on April 23rd, 10 days later, the FDA and CDC decided it was safe to start using the J&J vaccine again. And that is, the bottom line is, very large benefits outweigh the very small risk. So of these 6 people that developed the clot, I don't know how many of them died. I think maybe 1 or 2, but we now know that, oops, getting ahead of myself here. We know how to treat this particular kind of clot. The chance of getting a clot from COVID is huge. One of the things that COVID-19, the virus, does is it attacks the blood vessels. It attacks, like I said, every organ, the brain, the heart, the lungs, all the vessels. So it's the chances of you getting a clot and dying from COVID are much greater than the risk of getting this very rare form. 6 out of 7 million doses at that time. Now there's been 13 million doses of the J&J. So that number is so rare, and we know for a fact that COVID causes clots. So it's really important to keep that in mind. And when you hear social media or naysayers wanting to tell you that it's not safe, it's just not true. It is safe. The risk of getting COVID is much greater than the risk of these very rare side effects from the vaccine. So I want you to keep that in mind always. How is it safe if it happens so fast? Well, this is really interesting. I think the COVID-19 vaccine was developed quickly, but all of the same safety steps were followed that normally occur for vaccines. So we already had information. So coronavirus, which is COVID-19 is a type of coronavirus, is not new. The coronavirus has been around forever. We've been studying it. We had everything all lined up to try and get a vaccine initially before COVID-19 even became a thing. A lot of people participated in clinical trials. In other words, they didn't need to spend a lot of time finding volunteers. Normally, you would do your research, and then you would try to find volunteers, and then you would try to gather money. Well, the United States government, along with countries all in the world, this is a global pandemic. It affects everybody on the planet in some way or form, okay? So countries gather together the financial resources, and I think this is really important. The manufacturing started at the same time as the safety studies. So they were so certain that we would be able to find a prevention for this particular virus because we've done the research in advance, because we had the clinical trials running, that the manufacturers who normally might not do this because of financial risk, what if it doesn't work, right? But there was so much support, both from the scientific community and financially, and from governments around the world. They were able to start manufacturing while the safety studies were finishing up. So normally you can imagine, and let me show you this next slide. I think it's the next one. Yes, it's a little wonky, but you can kind of get the idea. So traditional timeline, research, initial development. This is testing, which is, that's what that is, that blob. Approvals, manufacturing and development, and delivery. Well, guess what? We had the research already for much of it in place. The initial development was done. Testing, again, we didn't have to chase down volunteers. They were readily available. Approvals, we were able to get the emergency use authorization. You'll see here this manufacturing and development, that was occurring while this was finishing up, okay? So if you consider that really moved the whole timeline along. And then the delivery component, as you know, the government was able to get it shots in arms very quickly this year. And so that's how that works. And I know people have expressed skepticism. Well, how could it be so fast? I want to wait and see. It's the same protocols, the same safety measures that would happen under any circumstances. This was not, they didn't cut corners, okay? So that is why it's safe. And here's something that we hear sometimes: can I get COVID-19 from the COVID-19 vaccines? The answer is no. The vaccines do not contain a live virus that causes COVID-19. That means you can't catch COVID-19 from the vaccine, okay? The flu shot, let's use an example, is not a live vaccine. You've heard people say, oh, the flu shot gave me the flu. No. What happens is, oftentimes during flu season, for example, there's flu in the community, right? So you are probably exposed, you get the shot, and a couple days later you develop symptoms of the flu. Well, how does that work? Well, it takes a while for your body to develop protection. So that's why you'll note that it takes 2 weeks at least for you to become protected against the virus. So these are not live vaccines. Not live vaccine cannot give you COVID, okay? It can give you some side effects, okay? So we'll talk about that. Side effects, sorry. These are the common ones: tiredness, headache, pain at the injection site, muscle or joint pain, chills, nausea, vomiting, fever. Okay. So again, if somebody were to get the shot and develop COVID, end up in the hospital, get real sick, it's because they were already exposed. It takes a couple weeks. It's not instant. It's not, oh, I'm good. Okay, it takes a couple weeks. The bottom line is the serious side effects from the vaccines, including the COVID-19 vaccine, are rare. Bottom line. In fact, during the clinical trials, which is when we were doing the testing on real life people, Pfizer, Moderna, and Janssen, side effects happen at the same frequency as they do in the general population. Okay, so that's less than 1% of the participants who received the vaccine. So if you've got a placebo group, people not getting the vaccine and people getting the vaccine, some of the placebo group are going to develop some symptoms as well. So it's only because it's very rare. The side effects are very rare. And I can tell you from personal experience, I kind of was looking forward to getting some side effects. I got nothing. Now, that's not to say you might get, when you get your vaccine, you might go really crummy for 24 hours or maybe even 2 days, and you're not going to die from COVID. And we care about you. Okay. Let's see. The side effects in adolescents were essentially from 12 to 15, on the Pfizer vaccine, you can give it to 12 to 15-year-olds. Were consistent with the clinical trial participants 16 years of age and older. If you got the J&J vaccine and developed any symptoms within the 3 weeks after the vaccination, you want any severe vaccine side effects, severe headache, blurred vision, shortness of breath, gut pain that doesn't go away, chest pain, leg swelling, easy bruising or tiny spots under the skin. That would be, of course, you go to call your doctor, go to the ER. That would be that clot that, again, is extremely rare, but we want to be transparent here. We want to tell you what you need to know, what's out there, the truth, the science, okay? In the Moderna vaccine trial, examples of serious side effects included 2 people with facial swelling and difficult to control nausea and vomiting, and 1 reported Bell's palsy. There was a shoulder injury from a Pfizer vaccine, and that could have been hard to know, but it could have been that the person giving the vaccine didn't do a good job. Don't know. But again, over millions and millions and millions of patients who've received the vaccine. We're talking about a handful of people that had serious side effects and they did not die. Okay. I think the important thing too to keep in mind is that we're being monitored. You're as time goes on, if you were to have a problem, it would be absolutely, you'd want to follow up with your doctor. We'll go through that a little bit more in a minute. Here's some other information. Who was the Pfizer vaccine tested on? Well, big surprise, 80% of them were white. But all ethnic and racial groups were included. And this is the same for all of the vaccines, Moderna and J&J. And you can look at this because this is being recorded. So if you want to peruse the numbers, you feel free to do that. But again, the important thing to keep in mind in all of these, on these particular group of slides, is that there was no difference in side effects and efficacy, how effective it was, any problems across any ethnic group, racial group. Okay, so I want you to keep that in mind. Let's see. Someone with allergies, should you get the COVID vaccine? So there is a small group of people who should not get the vaccine. And those are people who have an anaphylactic reaction to vaccines. Anaphylaxis is where you stop breathing. You have an overwhelming allergic response, histamine release, and you stop breathing. Now, these vaccines do not contain eggs, gelatin, preservatives, or latex. Here's the ingredients right here. You can click on that. If you have a history of a severe allergic reaction to something else that's not in the vaccine, like peanut butter, it says here to discuss with your healthcare provider before receiving the vaccine. Okay, I'll tell you what you need to know here. What you need to do is know that you're going to be at the vaccine site a little longer. We're going to keep an eye on you. We have epinephrine right there, and we're going to treat you. Bottom line is peanut butter is not in these, right? There's no peanut butter in the vaccines. Excuse me. But we are, we're going to keep you for a bit longer, 30 minutes instead of 15. We're going to keep an eye on you, and shouldn't be a problem at all. It's just really, if you have this anaphylactic reaction to something where you've had a vaccine before and you've had a real problem, those are the people that shouldn't get the vaccine, okay? Or at least talk to your doctor about it, all right? But other allergies shouldn't be a problem. We'll keep an eye on you. We're prepared to treat you as needed and keep you safe, okay? And I can almost guarantee that if you were to get COVID, you'd get a lot sicker than you would with the vaccine. So something to talk to your provider about. I'd like to have a baby one day. Is it safe to get a COVID vaccine? Okay, let's address this. So much is floating around on social media, and we don't want you to get your healthcare information on those platforms. We want you to get it from your doctors, from your nurse practitioners, people who can actually inform you about the science. Yes, people who are trying to get pregnant now or who plan to try in the future may receive the COVID vaccine when it becomes available to them. Well, it's available to everybody, so the answer is yes. Based on what we know right now, experts believe that the COVID-19 vaccines are safe for someone who is trying to get pregnant in the short or long term, and there is no evidence that fertility problems are a side effect of any vaccine. Well, I'll tell you what is a side effect of getting COVID. Preterm labor, maternal death, infant mortality. That's what happens. It can happen at an increased rate if you do not get the vaccine. If you get the vaccine while you're pregnant, it imparts some immunity to your infant, which is great. That is really wonderful. It's a concern that this has become such an issue, but the bottom line is it doesn't cross into the DNA. It doesn't cross into the placenta. It's okay. And I want you to make sure and feel safe and secure when you get the vaccine, but know that that is not a good reason not to get it, okay? We'll talk about that a little more. Here we go. Can someone who is pregnant or breastfeeding get a COVID-19 vaccine? The American College of Obstetricians and Gynecologists recommends that COVID-19 vaccines be offered to pregnant and breastfeeding individuals. Right now, we don't have much data about whether COVID-19 vaccines are safe for people who are pregnant or breastfeeding. So far, scientists haven't found any safety concerns for pregnant people who are vaccinated or for their babies. We do know that getting sick with COVID-19 during pregnancy can increase the risk of severe illness and might increase the risk of outcomes like preterm labor. Getting vaccinated is a personal choice for people who are pregnant or breastfeeding. A discussion with your healthcare provider might help you feel comfortable, but you aren't required to get their approval before getting vaccinated. Okay, so again, we're being fully transparent here. I can tell you on a personal level, family and friends who are pregnant, who've gotten the vaccine and have done just fine. Okay, Are they safe for children? The Pfizer vaccine is authorized for people ages 12 and older. Moderna is 18 and older. Younger children right now below the age of 12, it's not been approved. I think, fingers crossed, it's coming. Let's hope so, because at this point, what we've got are little kids who are having to mask up and keep the community safe. So I hope that it happens very soon. We'll see. Safety again is priority. So more on that later. Will COVID-19 vaccine change my DNA? No. No. And COVID-19 vaccines do not change or interact with your DNA in any way. Vaccines teach our immune system how to fight against a specific virus. In order to do its job, the COVID-19 vaccine doesn't need to go into the nucleus of the cell. That's where the DNA is kept. This means that the vaccine never interacts with our DNA in any way and has no way to change it. Okay, these are just some of the myths that are out there on social media, and you're going to have some knowledge now and be able to talk about this with your friends and family. And so I want you to keep that in mind. Okay, how do I make an appointment? Use myturn.gov. And actually, we're going to have more on that a bit later. Anna No, one of our amazing RNs who really put this all together for me, is going to chat with you about how to make an appointment and what to expect when you come into El Camino. But it's myturn.gov, myturn.ca.gov, and you'll get a code for El Camino, and you'll be able to come in and get the vaccine during our open hours. Okay, and this is amazing. We're trying really hard to make no excuses here to not get your vaccine. That's how important it is. What if I need help getting to or around the vaccination site? So here you've got Uber and Lyft in Los Angeles County, residents and public health. Okay, and you'll be able to access that. And let's see. You will not have to pay for the vaccine. Don't give anybody any money for the vaccine. And at El Camino, we will, if you have insurance, we'll build insurance. But if you don't have insurance, don't worry about it. Okay. If you don't have a driver's license, don't worry about it. If you're a DACA student, don't worry about it. If you, whatever your status, immigration, uninsured, no social security number, no, it doesn't matter. It doesn't matter. We're gonna make sure that you get vaccinated. Okay. If you're a student at El Camino, if you're staff, faculty, anything like that, you'll go to myturn.gov, and like I said, Anna will share that with you a little bit in a bit. Okay. Will getting the vaccine impact a person's immigration status? Absolutely not. Absolutely not. Okay. It doesn't matter. It does not matter what your immigration status is, and no, it is not reported as such, and you don't need to worry about it. And it's easy for me to say that, right? I'm here, you're out there, and maybe in your kitchen, or maybe at work, wherever you are, and you're thinking, oh, she can say that. I understand your hesitation. I understand your fears. I'm asking you to acknowledge that this is safe and it will not impact your immigration status. Know that. Okay. This is pretty cool. This Be Safe. I did it, and it's after you take your vaccine, you can go ahead and you'll go to the Be Safe app, and you can download that, and they'll check in with you periodically and see how you're doing. But if you have a problem, this will go directly to the CDC. Okay, so we want to monitor any reports that are outside the normal range, but it's helpful, and I would encourage you to go ahead and sign up for it. And how long after getting the COVID-19 vaccine does it take to be effective, and how long does it last? Well, I mentioned that a bit earlier. The average is 2 weeks, okay? That means some people are going to be protected at 10 days, some people are going to be protected a little more than 2 weeks. Overall, you do build antibodies. That's the protective mechanism that it imparts your immunity to COVID-19. Now, how long does it last? That's the million-dollar question. The antibodies will vary from person to person. Right now, they are looking to see if immunity over time starts to go down. It's likely that it does, although some studies are showing that it maintains at a very high level for a very long time. I think we will certainly hear about it. It may be, like I said, you need to get an annual or a booster one time. You might need to get an annual booster. We just don't know at this point. But for right now, we do know that you are protected for 9 months, and it might start to wane after that. We'll more on that. Just we'll get back to you later on that. As soon as we know, you'll know. Okay. And okay, next one. Do I need to keep wearing a mask if I am fully vaccinated? Well, on any forms of transportation, public transportation, the answer is absolutely yes. Absolutely yes. So trains, subways, planes. In Los Angeles County, as of Saturday night, the 18th, 17th at midnight. It is, they're doing a mandated mask for indoor activities. Bottom line is you are always safer outdoors. And we found that ventilation is really important. So if you're outdoors, you're not in close contact, less than 6 feet, you're in pretty good shape. If you're indoors in any kind of an environment where it's not open and well ventilated, absolutely wear a mask. I think, certain sectors have really made amazing accommodations for this. I'm thinking of restaurants and that sort of thing. Indoor restaurants. It's always safer outdoors. And so wear a mask when you go to the grocery store, wear a mask when you're in, it's mandated on campus. So you do need to wear a mask on campus. And right now the virus is allowed to spread because people are unvaccinated. So as long as it's out there and we don't have a handle on it, wear a mask, even if you're fully vaccinated. If you're not vaccinated, then by all means wear a mask everywhere you go. Don't get close to anybody less than 6 feet, because you could have it. You could be asymptomatic, or you could have it and be sick, or you could have it just been exposed, and 2 days later you're going to start showing symptoms. But in those two days before you start showing symptoms, you're very contagious. And the Delta variant is very contagious. We know that. And it's been allowed to develop, and it's now the predominant variant. And we will see more variants likely if this is allowed to continue. So get vaccinated, please. And talk to me if you're scared and if you have questions, okay? And here's how you do that. Okay. If you have more questions about your own health or about deciding to get the vaccine, we're available to help here at Student Health Services. Attend our weekly virtual COVID-19 Q&A session, Tuesdays at 10 a.m. And you can speak directly to me or one of the other nurse practitioners, any COVID-related questions or vaccine questions. Okay, it doesn't just have to be exclusively vaccine. If you're not feeling well, if you're not sure, is it cold, is it COVID, what do I do? Please check it out, and we have a one-on-one, and so we're there for you, okay? You can access this, go to our website, Student Health Services website, and you'll see the link right there. Okay, 10 a.m. on Tuesdays. So that's the interactive part, okay? I want to hear from you. Here's some questions, and this would have been lovely if we had we were all sitting around and we could talk about it. But I want you to think about these different questions. What concerns do you have regarding the COVID vaccine? And what concerns do people in your community have regarding the COVID vaccine? What information would help you trust the vaccine? I tried to give you information. I have given you information. If you need more, if you've got other questions, please don't hesitate to ask. And this is, each one of us has a community. If it's our family, our larger community, our churches, our workplaces, and we actually can impact our community. So I would like you to, talk to people that you know that are hesitant about getting the vaccine. And then talk to me, and we'll see if we can't help get some of these myths dispelled. What barriers make it harder for you to get your COVID vaccine? The location, the time off work, needing 2 doses. I think there's a real push now to try and have employers accommodate folks who might get the vaccine, might have some side effects, might be down for a couple of days. Of course, that doesn't do any good if you're self-employed, and I understand that. So we're going to, hopefully the local and federal governments will develop support for that, because that's a real issue. If you're working and living pretty much hand to mouth, it's hard to take days off, and I understand that. But for anybody who does have an employer, there's a federal mandate that they do have to accommodate you with some time off. So talk to your employer about that if you do feel crummy. You might want to plan that in advance. And then how can we make it easier for you? Let us know. Okay, we're trying. And let's see what else we got here. Should someone who is COVID-19 positive receive the vaccine? Yes. However, you want to wait your full 10 days of isolation. So you feel crummy, you get tested, test is positive, you got to wait 10 days until you're no longer transmissible. That's the point. What happens is if you go to say, I've got COVID-19, I'm positive, I'm symptomatic, or I'm asymptomatic, whatever, and I go to the student health center and I get my vaccine, you're putting the person at risk that you're coming in contact with. Okay, so that's the main reason why they want you to wait, complete your quarantine, your isolation, basically. Okay, and should someone who has had COVID-19 be vaccinated? Yes. Because if you get COVID-19, you're going to develop some natural immunity, right? We really don't know how long that lasts, but we do have a pretty good idea that it's after 90 days, your immunity really starts to plummet. So you're at risk for getting it again. You're at risk for getting that again. And so it's very important that you do get vaccinated. The natural immunity that you got from getting sick, from getting the disease, isn't going to last, period. Okay, and then with the other variants coming through, it's just not going to do it for you. Okay, Um, how will vaccines work against COVID-19 variants like the one that appeared in the United Kingdom? Well, we know about that. It works really well. All 3 vaccines work really well against the Delta variant. And so we want you to get vaccinated. Okay, it is effective. Now, that's not to say that as the virus is allowed to run amok, people are still not getting vaccinated and it's still out in the community, that's fertile ground for a new variant to develop. So until everybody gets vaccinated, it's going to be very possible that more variants will come to the forefront that will be predominant. And I don't know if the vaccine is going to protect you. At that point, it's very likely that the vaccination pharmaceutical companies will, in fact, I know they're working on it, trying to get a booster that is going to be effective against as yet unidentified variants. So, but the way to stop this whole thing, kibosh, put a kibosh on it, is go ahead and get vaccinated now and get your community vaccinated and help people overcome their concerns about the vaccination. And again, what can I expect at my appointment to get vaccinated for COVID-19? That's going to be Anna's bailiwick. Okay, so I'm going to pass it off to her. I hope to see you all on Tuesdays. Feel free to sign up, and I sure hope that you're doing well. And it's been my pleasure to be here, and I hope to see you all on Zoom. And the Health Center is open. We see patients on Zoom, and we'll bring you in if we need to bring you in, okay? So these are some other tools and resources that I want you to have, all right? So it's been terrific seeing you, and I'm gonna stop my share here. I'm gonna pause my recording, and Anna's gonna hop in, okay? Take care, good to see you all. Bye-bye.
Hi, everyone. My name is Anna, and I am one of the nurses here at El Camino College Student Health Services. I'm going to briefly walk you through how to sign up for an appointment for the COVID-19 vaccine. You first visit El Camino College's Student Health Services website at www.elcamino.edu/student/services/health. Or you can simply type in El Camino College Student Health Services into your browser search engine, and the first link that pops up will be ours. Once you've navigated to our page, look for the blue box right here. Click on this link. It will then prompt you to another screen. And when you scroll down, you'll find directions on how to sign up. You first email us at getvaccinated@elcamino.edu. An automated message with an access code will be sent to you. Next, go to myturn.ca.gov or click on the link we provided for you. You'll be prompted to another screen. This is My Turn. You'll be asked to put in the access code and answer a few questions. And when you're asked to find an appointment location, El Camino's location will be zip code 90506. So on the day of your appointment, you will come into the health center using our computer. You'll check in. We ask that you step outside after check-in, after you check into our appointment. We'll come get you shortly after you check in. And when you come inside, we will review the questions you've answered on My Turn to confirm that everything's correct. We then give you your vaccination. You'll then wait in a designated room after your shot for 15 minutes. If you have a history of having a reaction of any kind from a vaccine, we do ask that you stay for 30 minutes instead of the 15 minutes for monitoring. If you happen to walk by and want to get vaccinated but don't have an appointment, just come on in. We take walk-ins. And at this time, we're offering the vaccine for current students and staff only. All right, that's how you sign up for the COVID vaccine with Student Health Services. And that's what to expect on the day of your appointment. We hope to see you soon. In the meantime, stay safe. Thank you, everyone.